All right, well, we're now going to focus on the other big aspect of Omicron and what we are seeing around the world. We're going to look at what's happening in the United Kingdom and then talk about the importance of boosters all over the world. Professor Sanjeev Krishna, Professor of Molecular Parasitology and Medicine at St. George's University of London with us. Dr. Veer Pushpak Gupta with the National Health Service in the UK with us. He's also a member of the Royal Society of Medicine. And Dr. Rahul Pandit, a member of the National Task Force on COVID and a member of the Maharashtra COVID Task Force, also with us. Thank you all very much for joining us. Professor Krishna, firstly, 2 doses of say AstraZeneca, do they protect against Omicron?
Vishnu, thank you for having me, and good evening to you and your viewers. I just wanted to say one thing that before we answer the AstraZeneca question, 2-dose question. The level of discussion that we're having now and that you've just shown in the last 15 minutes, it's a different world from when this whole problem started. So I think we should just bear in mind that we are now 18 months, more than 18 months on in this infection, and we are both thinking differently and we have different tools available to look at COVID-19 and SARS-CoV-2. And part of that comes down to your question, Vishnu. What about 2 doses? Well, we must always distinguish first between protection from infection, which doesn't suggest the type of infection, the severity of infection, and then protection from severe disease, hospitalizations, and deaths. And the likelihood is that the 2 doses of AstraZeneca will attenuate, reduce the risk of hospitalization and death. But we do know that that approach is not so effective against Omicron compared with, let's say, 2 doses plus a booster, for example, of the mRNA vaccines. So, vaccines are being shown up in some ways by this new variant. And what they're doing is to really encourage us to go ahead and develop 3rd dose regimens, including, let's emphasize, mixing and matching different vaccine types. So we know, for example, in India, you are now getting access to or importing or going to be making locally mRNA vaccines, for example, and they would be extremely useful on a background of, for example, AstraZeneca. But the message is, let's vaccinate and keep vaccinating as much as we can, as well as using our other tools.
Dr. Rahul Pandit, for us here in India, would a 3rd dose of AstraZeneca, which is Covishield in our country, and I asked the same question about a Covaxin, would that protect us against Omicron? I mean, give us antibodies enough to give a reasonable amount of protection, not only from severe infection and hospitalization, but also from milder infection?
Vishnu, good evening. And first of all, I would like to congratulate Dr. Borka Koti on what he just presented on your show 5-10 minutes ago. That was fantastic. Coming to your question, I don't think we have data about Covaxin or Covishield additional dose protecting specifically against Omicron. What we know is that we need to separate this debate out for the sake of India at the moment. So there is a need to vaccinate everyone with 2 doses as quickly as possible. No 2 questions about that. But there is also a sizable population in India who have completed their vaccination in the month of January, February, March.
Yes.
And their antibody levels definitely would have gone down.
Yes.
So whether Omicron or not, I think the debate for a 3rd dose or a booster dose was definitely due right now. And I think we need to at least address that population and probably an additional dose for those who are immunocompromised, who probably never mounted a good response to the 2 vaccine. 2 doses of vaccine.
Correct.
What we need now is solid data in public domain about what happens when we mix and match Covaxin and Covishield, which are our 2 predominant vaccines. And if we're going to mix and match, if we have the adequate number of doses available. Because remember, almost 85-90% have received Covishield, and around 10-15%, if I may be wrong.
So Dr. Pandit, that's why I'm asking you, because there is no dearth of Covishield in our country anymore. It's unbelievable that I should be saying this 6 months ago. You know what the situation was. But now not only are we exporting, the Serum Institute says they're cutting down production by 50% because there aren't enough orders. So if individuals want to pay for a 3rd booster, for example, I got my second dose of Covishield about 7 months back, 6-7 months back, right? And there, like many others, by the grace of God, I'm not compromised, I'm immunocompromised or anything like that, but people would want their antibody. If they're willing to pay 600 rupees for it, then what's the problem?
No, I completely agree. I think it's not the question of money. I think money has to be decided, and of course people can be charged for that. That's not a problem at all. I think the booster should be given. Don't get me wrong, Vishnu. I'm saying booster should be given. What I'm not sure is that do we have the data to support that?
Right.
I don't think we have the data. So we'll have to go with the same amount, same vaccine for which we got the first 2 doses, because we just don't have the data for Covaxin and Covishield to be mixed and matched with each other.
But do we have the data for a third dose of the same vaccine, whether it's Covaxin or Covishield?
We don't. But that's not there in public domain.
Yeah, that's a key point. That's absolutely a key point. Dr. Veer Pushpa Gupta, isn't this what we are around the world grappling with? We are all talking about booster doses, but the information we have on the efficacy of booster doses against Omicron, and there is severe illness, hospitalization, mild illness, asymptomatic cases. We just don't know to what extent we'll be protected with the booster, right? Different drugs have different levels of protection.
Yes, thank you, Vishnu, for calling me on the show. And I would also like to congratulate the doctor you had earlier for doing such a great job on creating this PCR. It's absolutely fantastic. I can tell you what I'm seeing on the ground in the UK at the moment. Right now, the hospital that I work in is completely full, 117% capacity. ICU is completely full again. A&Es and emergency departments are full, and there are in fact lines of ambulances outside the hospital treating patients in the ambulances. This is the current situation. Now, whether this is because of Omicron or whether it's because of the winter surge, which usually happens in the UK, I don't know. But the fact is, Omicron is a faster transmissible virus, less severe than Delta. And what that usually does is, because of its fast transmissibility, it has the ability to overwhelm a health system. So if the NHS is getting overwhelmed right now, I would most likely point it down to the fact that Omicron is spreading quite fast in the community. To answer your question about the booster dose, I think in the UK, I think the decision to give the booster dose has been given because most of the population is now vaccinated. 90% up and above have gotten their 2 doses. The last dose that I got, as you mentioned, I got my dose in February, my second dose. So my immunity started waning after about 6 months for that dose. So I had to get my booster done. And I think that's the main reason. Waning immunity is the main reason why boosters help with Omicron, and that's why they're needed. India's vaccination rate is 53% right now. I think we should start rolling out the boosters for that 53% population, especially for the healthcare workers, at least, because they're the ones who are going to be dealing with this on the front line.
Just a final question to you, Professor Krishna. Are there reports of deaths as a result of Omicron in the United Kingdom? And could you add more to what Dr. Gupta just mentioned about hospitals being flooded? Because what he says is really frightening. I mean, it just sounds like Delta all over again.
Well, yes, of course. I just wanted to emphasize that I think we do have information that the booster works, but getting a third AstraZeneca may not be so effective because of the nature of the vaccine. Because you get antibodies to the vaccine itself, to the adenovirus, not just to the SARS-CoV-2 bit of the adenovirus. So that's why mixing and matching in this instance is really important, and why mRNA should be coming on board as much as possible. But boosters, third doses, do provide protection against infection. When it comes to the question of deaths, the very important question of deaths you've asked, it's going to take time for deaths to filter through, if indeed they do start to filter through, because it takes about 3 to 4 weeks after hospitalization when you start seeing people actually unfortunately succumbing despite the best treatments. And we've got far better treatments now than we had. The backlog in hospitals, the pressure on the NHS, it's always like this in winter, but we are really bracing ourselves because we've got an exhausted population of healthcare workers. In fact, there's viral fatigue throughout the country as there is globally. And, you know, that problem, burnout in healthcare workers, emotional problems, just fatigue, is going to be one of the main features that we will have to contend with, as well as worsening numbers, as well as other cases which are not being managed in the acute situation because hospitals are full.
All right. Well, gentlemen, it's thank you so much for sharing your thoughts. Early days yet on the efficacy of boosters. We just know that it works really well when it's mixed and matched. It also depends on vaccine availability, and that in India is a huge concern because that variety of vaccines is not there at the moment. But I think it's quite clear that this booster rollout has to start sooner than later. I'd like to thank you all very much for being with us. We're completely out of time on this program. From all of us here, goodbye.